Hello, everyone. It's Laurie White from the Greater Providence Chamber of Commerce, back again with our 96th episode of Chamber TV. And today we have a great guest and a great conversation lined up for you and for all of us. We're talking about healthcare and a new company that is coming to Rhode Island in the coming months to add to our already excellent nonprofit healthcare community. So I'd like to officially welcome Chris Palmieri, who is the president and CEO of Commonwealth Care Alliance. So, Chris, welcome, and how are you today?
I'm great, Laurie. Thanks for having me.
It's great to see you, and we start off all of our programs pretty much the same way, where I want to reach out to you and welcome you and ask you how you are, how's your family, how are you doing?
It's been a long 2020, getting through it, and we've had a really successful year in serving our customers in Massachusetts, and my family's gotten through it. My kids go to school in New York, and they have actually been in school, and my spouse is a teacher also in New York, and she's been mostly in her classroom. So we have made it through thus far this incredibly challenging year. Thanks for asking.
And I have to point out, in the spirit of the room raider theory, that your backdrop looks absolutely spectacular. So I would give you a 10 out of 10.
Oh, I think it's really accidental. I've inverted the space that I normally sit in when I work out of this office, and I don't actually even get to enjoy that background on Zooms. I'm traditionally looking at it, and in my backdrop is a window, which would be too bright probably for your satisfaction. So I'm glad it's working.
Well, we all do what we have to do in these times. So let's start right from the very beginning and talk a little bit about Commonwealth Care Alliance and your plan to bring the alliance to Rhode Island. So tell us all about it.
Yeah, so we started in 1976, a husband and wife, both physicians, that were serving at the time Boston's most underserved populations, those with physical disability, mental illness, severe chronic illness, people with HIV and AIDS. And over time, we have grown into a health insurance organization, continuing to provide healthcare coverage to the same populations. And we continue to be rooted in primary care, as well as services that really take care of those with mental illness and physical disability. And I've been with the organization since 2015. It's really been a privilege to serve now 40,000 people in Massachusetts. And I can get into specifics about our model, but one of the things I wanted to share is that we are really excited to come to the state of Rhode Island. First of all, we think that our approach to care, which is putting the individual that is our customer, our patient, the person that we're coordinating their services for, at the center of everything we do. And we believe that person-centered care is really an opportunity to provide great healthcare in Rhode Island. The way that we do this, which is the core of our mission, and has been recognized as one of the best in the country. We feel that, again, we want the residents of Rhode Island to have access to this. We have been able to take and really, again, going back to almost our roots in the 70s, our care and keep people at home where they belong, keeping them out of the hospitals. We've been able to reduce readmission rates when we study populations that have been with us for a year by nearly 10%. As well as keep people out of the emergency room. And we look at reducing emergency room occurrences by 3% in the same sort of year analysis. And those are just two places that when not needed is places that you want to keep people at home. And we think that approach will be very beneficial. It also helps improve quality and people's engagement, and at the same time, it decreases healthcare costs by putting the site of service back in the community.
So that is a great way to begin. And of course, our key concern and objective is quality care, efficient care, doing it at the place where the patient is available. So I love the idea that your team actually goes in and into the home with a team of paramedics that addresses some of the, the urgent needs that you're seeing right there, which we can get into. But of course, why we are talking about this is that Medicare, Medicaid are huge issues for the state and the state's budget and finances, and the degree to which your team can ally with all of the providers in our particular area, in this service area here in Rhode Island, and work to address the escalating costs of healthcare is also a major win for employers, right?
It is. The taxpayers support healthcare that is for low-income individuals and folks on Rhode Island's Medicaid program, Massachusetts's Mass Health program. And if we're able to reduce the cost of healthcare, it reduces the tax burden or pressures that is placed on the employer communities.
You have been extremely successful in Massachusetts, and your program and your organization is a darling favorite of Governor Baker's. Tell us a little bit about the impetus for moving across the border into Rhode Island, and what are you expecting from the players here?
Yeah, I mean, first of all, I would say, just to review some of the success we've had in Massachusetts. When I joined the organization in 2015, we were quite a bit smaller. We employed about 600 people and had just over 15,000 consumers that were our customers. Today, we have 40,000 consumers, and I've been able to add 1,000 meaningful jobs in our organization. We employ over 1,600 people. So, when we think about coming to Rhode Island, we do think about addressing 30 to 50,000 consumers that we believe can use and access our services vis-a-vis the state's Medicaid program. And the folks that we're really targeting are those that not only have Medicaid, but also have Medicare, also known as the dual eligible population. They have Medicare either because they've turned 65 or they have a qualifying physical disability or mental illness and they're under the age of 65. So we believe that our person-centered approach, which does utilize our staff in a multidisciplinary healthcare coordination and delivery team, people like physicians, nurse practitioners, nurses, social workers, pharmacists, health outreach workers, would be able to join our organization and help us deliver this coordinated care in a person-centered approach. So we think that first of all, it will absolutely improve the quality of life for those Rhode Island residents that end up becoming our customers. Secondly, we do believe we can reduce healthcare costs. And third, we believe we can again bring meaningful roles to people that live in Rhode Island to come and join our organization.
If you're just joining us, we are talking to Chris Palmieri. He is the president and CEO of Commonwealth Care Alliance. They're a new company. They're coming to Rhode Island, and we're talking about ways in which the local community can engage with this new organization. We are live on Twitter, we are live on Facebook, and we are live on YouTube. So we are gathering your questions, and hopefully we'll be able to pose those questions to Chris as we go along. So tell us a little bit about your entrepreneurial background. You bring a very distinct skill set to Commonwealth, and some of the work that you've been able to put into place in your role driving healthcare in Massachusetts. And tell us a little bit about how that sort of plays out in the current environment.
Yeah, so I've had a very blessed career over the last 26 years. I've been involved in a number of startups, organizations that needed to be turned around or re-engineered, and have had the opportunity to as well capitalize new businesses. So at CCA, it was very much a transformation effort. It was a wonderful idea that, again, went back to the 1970s. It needed to be scaled. We needed to bolster some of our business processes, bring more technology to our operating platform. And we did all that over the last 5 years. And, I would say that in that journey, we never lost sight of our customer. And in fact, our consumers rated us the #1 health plan in the United States 2016, 2017, and 2018. And we were top 5 in 2019. And we're very proud of that. We were also, based on CMS's rating system, a 4 or 4.5 star rated plan based on our quality. scores. We're currently 4.5 stars. So as we were thinking about innovating and bringing a lot of the entrepreneurial approaches to CCA in Massachusetts, we were also able to improve our quality and never lost sight of our customers. In 2016, we decided that we had a bigger role to play in capitalizing entrepreneurs that were doing things that were exciting to us in the space of caring for vulnerable populations and advancing technology. And we have now invested in 3 companies that are doing a variety of interesting things, one of which is in the remote patient monitoring space. We made a major capital investment in that company and then recapitalized it at the beginning of the COVID pandemic and are now moving out over 3,000 devices to help us connect with consumers that are homebound and isolated, which again is just one example of things we're doing in the pandemic. The other thing that that we've done, and again, we want to bring both of these efforts to the state of Rhode Island, is in 2015, as we were studying the behaviors of our then 15,000 customers, we realized that there were people going to the emergency department for things that really we believe they could have been treated for at home. And as they were going to the emergency department, these were folks that had major complexities and were showing up, and the hospitals were concerned about the conditions of folks and oftentimes didn't understand their multiple comorbidities and mental illnesses and polypharmacy issues. And we decided that there would be a better way to serve populations where they never had to step foot into the hospital or the emergency department. And we now have a company called Instead, which essentially uses paramedics and delivers mobile integrated health to people right in their living room. And they can call us on demand for that service. And instead of dialing 911, they call their care manager in our organization or call our intake line. And we're able to, in 30 minutes, dispatch a paramedic to them that can diagnose their situation, decide if they still need to go to the hospital or if they can be treated in place. And we've had wonderful success with that initiative.
That is brilliant. Seemingly simple concept, difficult to execute, and certainly one that takes the mind of an entrepreneur to sort of, journey map exactly the experience of these individuals, what they're suffering with or presenting with at that moment in time, and triaging it and doing it in a way that's personal, high quality, and of course, at a lower expense. So tell us a little bit about how that mindset actually came into being, and when it seemed like such a simple concept.
Yeah, I mean, first of all, it's been in the DNA of our organization since Bob Master and Marie Felton created us back in the 70s, and the sort of unwillingness to accept the status quo and always finding a better way to treat people. And again, the consumers that we're describing oftentimes, and certainly back in the 70s, were left behind by the healthcare system in so many ways. And that part of our culture has lived on. And that's something that I've also had really the drive to want to continue to innovate and just potentially do a better job where there's opportunity. And that's a big part of our culture. And in this particular example, there was a physician that was doing case review on these cases that were showing up in the emergency department, and frankly, subsequently being admitted to the hospital. So these were folks that thought that they were going in for a very brief treatment and ended up staying in the hospital for many days because they were quite sick. And that physician, a great individual, he's retired from our organization now, Dr. John Locknane, said there has to be a better way, and created a pilot with a local ambulance company. And then we ultimately were able to persuade the Department of Public Health in the state of Massachusetts to put this into regulation and create the mobile integrated health program, of which now we are one of the larger ones in the state and serving our own consumers and several other organizations, but we're not the only one. So we were able to pioneer an idea that has really taken off. And I believe the leadership in our state, from the governor down to his entire cabinet, had the foresight to listen to what we were telling him, and others were saying that there had to be a different way to deliver services, and here we are.
Congratulations on those rankings. Very impressive. And the star rankings, that doesn't come easily.
It doesn't, and it really has taken an effort of the entire organization to be focused on the consumers and close the necessary gaps in care that exist to bring those ratings up. And as I've said, we've always been focused on the individuals we serve, not necessarily just getting a good grade on the test, but we've been fortunate that the way that we've approached the problems has resulted in these wonderful scores. And the CAP score that I talked about is actually the consumers themselves responding to a telephone survey and rating us in terms of how they feel about what type of job we're doing with them and whether they would recommend us or continue to stay with us. So we're really proud of all of these wonderful scores. But at the end of the day, for us, it's really about the people we serve, not necessarily the scores that we get. And we've been able to help so many people with our products and services.
Tell us a little bit about what you have been doing during this COVID era to treat your members.
Well, there's a variety of things, and I remember back in March when things started to shut down. It was my daughter's 14th birthday, and at that point, I think we all thought this is all going to be back to normal in 2 weeks, and we did a variety of things. So first of all, from the perspective of our members, our goal was to put them first, above everything, above reimbursement, above any financial circumstances. We felt that the people that were under our care and insurance were those that were most vulnerable to be impacted negatively by COVID. So we wanted to focus on how do we continue to make sure that our customers have the supports that they need, both in the community as well as through the channels that they historically have relied on, personal care workers in their home, receiving primary care, et cetera. And we had to pivot to a virtual care model. And today I'm still, aghast that we're still in the middle of this pandemic. But at the same time, we've touched our members, all 40,000, more than 1.2 million times. Early on, we mobilized a team that was able to go in the field. It started with about 40 individuals that had personal protective equipment and were prioritizing who really needed to be seen in person. Today, we have over 100 people that are in the field, and we've made over 10,000 field visits in this, last now what's nearing 300 days of COVID. We also decided that we needed to allocate some financial resources to help our members with things that, who would have thought that someone would need Gatorade or tissues or sanitary wipes or hand sanitizer, or just some of the things that we all take for granted, tuna fish. So we allocated $4 million or $100 per customer to be able to buy essentially what they needed to get through this. The second thing we did, like most employers, early on, we sent everyone home. And we had never had our staff working remotely for more than 2 consecutive days because of inclement weather. Our folks haven't come back to work. They've been working fully remotely. We've sent them the technology that they needed to do their jobs. We've sent them, if necessary, chairs and desks and all of the things. We've paid for their internet coverage over for the first period of COVID. And we really wanted to support our employees. We were having live town halls with them every 2 weeks to make sure that we were answering the questions that they had. And the questions ranged from, how do I connect to our systems to, are there going to be layoffs? Is the funding going to change? Is there going to be a cure for COVID? I mean, these were the questions that there was so much despair back in April, May, and June. And we hit all these questions head on with our workforce. And the other thing that we did is we reached out to the Commonwealth of Massachusetts right at the beginning and said, how can we help you? How can we help you as a state? We know this is going to be a very significant situation. I have had the experience of leading an organization through post 9/11 cleanup as well as through Hurricane Sandy. And you never know when you're going to have to call on your crisis management experience. But when we reached out to the state, I think initially they weren't sure how to take advantage of the offer. But soon after, they reached back out to us and asked if we would run an operation that was going to treat COVID positive homeless individuals in the community through 500 hotel beds that they had secured in 6 locations. And they hired us to run that operation for them. And that operation has treated so many people And unfortunately, with the increase in the prevalence of COVID right now, that operation continues to serve so many guests. Hundreds of them at the moment are occupants in the operation.
Yeah, that's amazing. So major hotels in the Boston area, greater Boston area, acting as hosts, if you will, to your member population that are.
It's not our members. These are folks that are in the Massachusetts Medicaid system and are homeless and would normally most likely seek out healthcare in an acute care setting, but given the need of the acute care beds for much more significant cases, we need an alternate setting to serve this population and their families while they were essentially recovering from COVID and not infecting others. Mm-hmm. This operation has been funded by the Massachusetts Emergency Management Agency, overseen by the command center. And it's been our staff that have been the operators of it. And it has been just a remarkable operation. And we're proud again to be able to serve the Commonwealth in this way. And we feel that it's our duty to do so. This is something that, I feel compelled that if we are in a state and have a relationship with a state, that these are the types of things that leaders do in crisis. You lend a hand. And we've been really glad to do that.
The advent of telemedicine has really been a gift to all of us, giving rise out of the pandemic. And no doubt you've made great use of telemedicine services in talking and treating your members. Thoughts on how that plays out, and how does that play out if somebody was experiencing what you described or needing a visit in the living room? Would a telemedicine call be an appropriate substitute for that?
We think it would be. And one of the things that, as we look back and we reflect on this circumstance that we've all been in, some of the bright spots are, what are the learnings? What did you learn from this tragedy that impacted so many people? And pre-COVID, telemedicine's adoption was relatively low. Whether it was from using the lowest technology, analog type literal telephone conversations, up to video consults, it did not have a high adoption rate. And now everything has really changed. People are using it as a modality of treatment. There is reimbursement for it, and our perspective has been to keep the opportunities to use these channels in place, because it has greatly improved engagement with consumers, not just our consumers, but the healthcare community at large, to be able to access primary care coordination, necessary behavioral health visits. And I think that as we think about our own model, which historically has been done in someone's living room, in someone's home, multiple times a month, this is another way to access consumers. It will not replace, by any manner or means, the intimate conversation that two people will have face-to-face about their healthcare challenges or their social determinant needs or their behavioral health needs, but it certainly will supplement it. And we hope that the outcome here is that there are more touch points. And as I said, we've done this over 1.2 million times since this pandemic has started, and we're a true believer that this is going to be a big part of our model as we look forward.
So the 1.2 million times were 1.2 million telehealth visits, or visits in general?
Telehealth visits, video consults. So telehealth broadly defined, and that was, so for our 40,000 people, if you think about that, people have been touched. Is that my math? You're testing me 30 times roughly each, is how that's happened through the pandemic.
Could you paint a hypothetical picture of a typical member, if typical is an appropriate term?
Well, no two members are alike, but let me sort of break it down this way. So we have two cohorts of members, those that are over the age of 65 and those that are under 65. So the under 65 population, the average age is 51 and a half. Nearly 10% have a major physical disability. Think about things like paralysis, spinal cord injury, multiple sclerosis, muscular dystrophy, cerebral palsy, like my 61-year-old brother who lives in New York. 75% have a physical or behavioral health disability. 55% have 4 or more chronic conditions. Nearly 70% has severe mental illness. So that's that cohort, the group that is served by, in Massachusetts, our One Care program. In the Senior Care Options program, which is designed for people with Medicare and Medicaid over the age of 65, the average age is 76. 72% of those individuals are nursing home certifiable, which means that they have chronic illnesses sufficient enough to qualify them to live in a nursing home full time, yet they're able to live at home. 60% have a physical or behavioral disability, and 70% have 4 or more chronic conditions, and 54% have diabetes. And the other thing that I think is important about our seniors population is that 60% speak a language other than English.
Remarkable, but not surprising. I think we all understand that is the face of our neighbors today. And now that you mentioned what you experienced in your own family, I can see that perhaps was among the drivers that brought you into this very special role and the very special role of CCA.
Yeah, when I look back on, again, the career that I've had, my entire career has been focused on serving vulnerable populations. And, it wasn't until 5 years ago that someone very pointedly said to me, I think you do this because it's in your family. And I said, of course it's in my family. My 2 oldest siblings, or my oldest sibling is also in healthcare leadership, as is my sister. But my middle brother, who's 61, has a physical disability and some behavioral health issues, and he's been cared for by our family his entire life. And I was a big part of his healthcare. I like to believe I still am, but since we don't live in the same house, I don't want to take credit for that. But he really has colored and informed so much of my thinking and viewpoints. And every time I think about what we do at CCA or what I've done in some of the past opportunities I've had, I think it really is because I want to build a better healthcare model that will care for him too.
I think what you're describing is that the family has been able to step in and take care of his needs all 61 years of it. And looking at it from a big picture perspective and wearing a special sense in your heart, said, this is probably a very unusual situation to be able to have family members do that over the course of a lifetime. So no doubt sparked, the creativity in your own mind to find another special solution.
Yeah, I mean, it's some of the things are simple and we take them for granted. It's, the things that, are sort of artfully coined today as addressing the social determinants of health, right? But it's what are these things that get in the way of somebody actually receiving good healthcare? Transportation, do you have food? Do you have heat? Do you have stable housing? Those are all things that are in the model of care that CCA has practiced for so many years. And when I think about, again, my own brother, who now is living independently, sort of the race for our family to get him stable and secure housing so that he could receive all these healthcare services. And it really is, the access point. And then, obviously he can't drive. So how does he get transportation so that he's not isolated and not, frankly, fully reliant on another family member to do everything? I live 4 hours away from where he lives. And, the one that's closest in his circumstance is my sister, and she has her own family and her own employment obligations. So when you think about, the obvious choice is, well, you can just lean on these resources, but sometimes they're not there. And to get these issues, and how do we, get someone to be social or get to the doctor's appointments? And again, those have been things that have been embedded in the CCA practice of care, and are things that are integrated in the Rhode Island model as well, that we're so focused on being able to participate in the Medicare and Medicaid plan. in Rhode Island, it is, encompassing all of these services, which are not, again, they're not only healthcare services. They're some of these other things.
Yeah. So you mentioned the social determinants of health, and I read the piece that you authored in the Providence Journal earlier this month, sort of outlining some of the learnings as a result of COVID-19. Yeah.
I mean, there were 4 points that I made in that piece, and I have it here, and I was proud to be able to author that. But, first of all, you have to care for somebody in the community. It has to be at the community level. So using the resources around an individual where they live is what needs to be leveraged. The second piece is you have to find access points that work for the customer. I mean, imagine that we're actually not just pushing healthcare and healthcare services on somebody, but you have to actually find ways for that individual to access healthcare that is going to be something that they're willing to accept. And whether that is in the doctor's office, or again, as we've talked about, in someone's living room, is really critical. Otherwise, they're not going to engage. And we learned so much of this from the way that we stood up the isolation and recovery sites, the way that we treated our own consumers throughout the pandemic. We need to continue all of this post-COVID, because it would be a further tragedy if we didn't learn everything that we've experienced through COVID and helped evolve our practice. And then lastly, individuals that have high healthcare costs or at high risk, they need to have choice when it comes to their healthcare. This is not something that should be forced on a consumer. And this is why in our organization, our culture, we call people consumers and customers, not patients or members, because I want our employees to recognize that the folks that we serve, they have a choice in their healthcare, and they should have a choice. And they could choose not to get services from us, even if it meant taking nothing. And that's something that we're very aware of, is that we have to treat those that we're privileged to serve like they're customers, because they are customers, and treat them with the utmost respect and dignity, and honor the choices that they have.
That's really an interesting perspective, and I'm wondering, you've been in this field for a long time, and from a longitudinal perspective, what have you picked up as big shifts that have occurred in treating a very fragile customer population like you're describing? What's changed over the last 20 or 30 years on what you're really seeing in the field?
Yeah, I think there's a variety of things. So first of all, and maybe not in any order of magnitude, but there are these non-healthcare things that we call social determinants that really do matter. So transportation is going to have a huge impact on healthcare costs or housing. The second piece is the role of the primary care provider is really, it's back to where it was 50 years ago, when we had physicians that were walking into consumers' homes and carrying a bag. Healthcare is back in the home, and the primary care providers are at the epicenter of it. And that's critically important, but it's not the only component. The fact that you have to address an individual's behavioral health needs as well, and oftentimes before their medical needs, is critically important. And probably last and definitely not least, home is where this should all happen. Moving the site of service away from physician practices or offices, the emergency department, oftentimes the acute care hospital, and doing as much at home as we possibly can is going to improve the engagement rate of the consumers, their willingness to accept the treatment that's being requested of them to adhere to. It's where people want to be. When you're sick, you want to be at home, and if you can be cared for at home, then you should be. And those are just really incredible learnings. And if you put all of that together, I believe we can continue to design a system of healthcare that will be better in the years to come. It will be more cost effective. It will deliver much higher quality. And I believe the consumer, and again, the consumer who should be in the center of all this, will be much more engaged in their own self-care and self-wellness.
So you're talking about the social determinants of healthcare, and one of the most painful and heartbreaking things that have occurred as a result of the pandemic is that the two are very much intertwined. In those populations, those customers that are the most fragile, that are the most indigent, of course, are the ones that are being exposed to environmental pollutants and other things. Those are the individuals that are really on the front line of being truly, truly the sickest of the sick, at least at the outset.
I totally agree. And these are also the folks that, when you think about the resources that individuals have or don't have, there's continuing to be a widening of the disparities gap. One of the things that we talked about was how brilliant telehealth has been. Well, the reality is not everyone has a cell phone or a smartphone. They have the phone that's ringing in my background right now at best, and they're able to really only engage in a lower level. And this is something that we have to really be thinking about. How do we advance Wi-Fi to people and actually get them not only the technology literacy, which is going to be required, but also the device that actually they can do the video consult on. Those are things right now that they're not paid for by the healthcare system for low-income individuals. And I think there's going to be conversations open in the future that really that will sort of hopefully move that opportunity down the field.
Yeah, so that is really interesting. It reminds me of a conversation we had on Chamber TV last week when we talked to the superintendent of schools in Providence, and he talked about students who weren't showing up to school, and he himself and his colleagues in administration would show up on folks' front porch, and ring the bell, knock on the door and say, hey, we miss you. We love you. Where have you been? Oh, you don't have a laptop. Oh, you don't have Wi-Fi. I'll be right back. I'll go to my car. So, talking about big bureaucracies delivering right to the home, as you're pointing out, people do not have a lot of this equipment. And it's a way that not only stymies healthcare and education, but other things as well. So the ability to fulfill what you just said of getting those basic things, bringing it to the home, is something that's taking root in a variety of other fields as well as a result of this COVID. So lots of innovation, lots of creativity.
No, it makes total sense. And I hope that it opens the eyes of everyone that you can have the most sort of well thought out plan. If you think about actually how healthcare has been delivered during this very challenging time, organizations have been able to execute. And the same thing with education. But then if you're missing that one last inch to cross the 26-mile of the marathon, the device or the stable Wi-Fi, it all collapses.
Right.
And my hope is that people take notice and we find a way again to look at technology, access to the internet potentially as another social determinant, because these are going to be really necessary ingredients to continue to keep these high engagement rates that we've enjoyed for certain customers, but not all of them.
Yeah. So this is a perfect example of design thinking, right? Peeling it back, continuing to ask, why to this impediment all along the chain, and then, you get to the root cause, which is no Wi-Fi, right?
Exactly.
So that's the entrepreneurial thinking. So I'm really excited about your arrival in Rhode Island and the beginning of that. So let's spend the few minutes that we have left talking about, when, how many employees, how can folks get in touch with you? Do you have openings for talent that you are trying to source? Tell us a little bit about your perceptions of our innovative and quality-driven healthcare environment here.
Yeah, so we have already started our work in Rhode Island, and we've been quietly working on the development of our provider network and building relationships with the leaders that will ultimately regulate us, those that are elected officials, and educating them about our approach. We've been doing that for about the last 6 months. At the same time, we do have some opportunities already, and for those that are watching, we are looking for a market leader for Rhode Island, someone that will be our general manager, and that posting is on the CCA website. And we will continue to add to the team of individuals that we want them to be of Rhode Island and from Rhode Island and really know everything Rhode Island and help teach us more. So our hope is that the public will start to see and hear about us over the summer, and the potential consumers around October 1st of 2021. And we hope to start serving individuals in January. And with that will come the opportunity for us to really staff up. As I said, in Massachusetts, we've added, since I joined CCA in 2015, over 1,000 employees to our company. And I hope to add 1,000 employees to our company that are people in Rhode Island to focus on our Rhode Island business. And we think that will happen over several years. But we're really excited about it. And a lot of our employee base will be tied to the volume of growth that we have. But we intend to be very proactive in reaching out to the consumers in Rhode Island. And we hope that they ultimately choose us as their health insurer and potentially provider of choice. And that we think that will create a tremendous amount of opportunity.
Also, another accolade, the Boston Globe recently named you as one of the top places to work in Massachusetts.
It's something that we're incredibly proud of. And, again, I do believe that if you treat your employees well and you have a culture that fosters teamwork, collaboration, open communication, integrity, and honesty, then great things will happen. And this award was a great thing. And in particular, this survey measured employees' opinions about, where's the company going? How well is leadership executing? What's the connection that I have as an employee to my employer? What is the role? How is the role of management working? Is the organization have a pay and wage scale and benefits that are of market? And is do I feel engaged? And again, our employees rated us incredibly well. And it's a testament to the staff that care so much about our 1,600 plus associates. And again, that's just it's a big piece of our culture. Every time I address our workforce, I explain to them, they're one of my customers. And people, again, just like our health beneficiaries and patients choose us to be their healthcare provider, I believe our employees choose us to be their employer, and we have to treat them as such. And COVID has been just such a challenge, and no different for those that work for us. And we have been as focused on the health and well-being of our employees as we have our members. And I'm really proud that they thought enough to rate us in the way that they did, and it got a top mark with the Boston Globe.
You mentioned that you are recruiting for the team lead here in Rhode Island. What skill set are you looking for? What particular talents and aptitudes?
Yeah, it's a great question. So first of all, obviously someone with healthcare experience, someone that understands how to build and lead the provider community. So we will have contractual relationships with the provider community, and someone that can help do that. Someone that understands the role of sales and marketing and how to outreach to the consumers and the channels that would make our programs and services be aware in the marketplace. Someone that has had experience potentially leading a health plan that has coordinated Medicare or Medicaid financing, and someone that understands how to work with the regulators, the policymakers, the elected officials in the state of Rhode Island.
How do you imagine working with the incumbent insurers such as Blue Cross, United, Tufts, Neighborhood, and other providers in the insurance industry as a cog in that wheel?
Yeah, I mean, first of all, it's a great group of organizations that are offering health insurance, and we want to join them. And our hope is that, as either they raise the bar or we raise the bar, that everyone else will sort of, everyone's boat will rise with that tide. So, our objective, and as it's been in Massachusetts, is if we do a great job and we set a high bar, others will aspire to hit that bar or beat us, and the same for us. And we think that the outcome of that is a better product for the consumers that live in Rhode Island, and that's something that we hope that we're welcomed. We recognize that we also compete with each other for the same populations, but it's a collegial competition in a manner of speaking.
Mm-hmm. What other business relationships are you looking to forge? What other, perhaps, members of the Greater Providence Chamber of Commerce are you looking to partner with, or services that you might need as you begin to stand up this operation in Rhode Island?
Well, it's the whole gamut. We're going to be looking for office space in strategic locations across Rhode Island. So all of the services that would support an operation, any of those businesses, we want to certainly create relationships with. We want to bring our venture capital accelerator arm, Winter Street Ventures, which is the entity that I described earlier that makes investments in healthcare entrepreneurs and startup companies. We want to be able to bring capital to Rhode Island to continue to create the innovation that we've been so proud of. So anyone that sort of is in those spaces or adjacent to those areas that we're interested in, we want to hear from and certainly have the opportunity to meet and talk to folks.
I want to circle back to the venture capital arm. I think you mentioned two of the ones that you capitalized and recapitalized. What was the third one?
So one was in primary care that we were fortunate enough to make a small investment in an entity that was started by two of our former employees. One was a remote patient monitoring company, and the third is a revenue management company. And again, all three of them, the thread that sort of brings all of them together is they're advancing cutting edge technology in how their business model has been created.
Fantastic. So do you expect that you will be looking for other opportunities, other ventures to support and to capitalize, and always on the lookout for that?
Yeah, I mean, we're a startup incubator. So this year we have about $5 million to allocate to startups, and whether we do that with 5 new startups or 10 new startups, or maybe 2 or 3. We'd love to be able to do that with entrepreneurs that are based in Rhode Island and doing things for the Rhode Island communities.
Okay, so for all you startup companies out there and those that manage startup companies as either mentors or other sort of professional service providers, don't forget the fact that CCA is looking for good deal flow. So that's amazing. We one of our dental insurers, Delta Dental, Joe Peroni is the lead there, very interested from his Delta Dental perspective in investing, similar to what you are describing. So perhaps there's some synergy there with the dental insurance community.
Absolutely. Sounds like Joe and I should be getting together.
Absolutely. Well, we look forward to working with you, no doubt, as a member of the Greater Providence Chamber of Commerce, and hearing more from you relative to your needs as you get acclimated here in the community. We are really excited about the fact that you are going to be adding to our employment base with many hundreds of jobs. If folks want to learn more about the types of talent you're looking for, what would be the best way for them to familiarize themselves with what you are looking for?
They should go right to our website. Yeah, they can go right to our website, just if they, which is up on the screen right now, but it's CommonwealthCareAlliance.org. And if you just Google Commonwealth Care Alliance, it will certainly point you in the right direction. If you're interested in learning more about our ventures company, the name of that company is Winter Street Ventures. And again, you can pull that up on the internet.
Conveniently located, because no doubt you're located on Winter Street in Boston, right?
30 Winter Street. So that name has some significance.
Yeah, well, that's right in the epicenter of probably a neighborhood where many of your customers would spend a lot of time, no doubt. So I can visualize the area very well, and I'm sure that we will have an opportunity very soon to continue this conversation and work with you and make sure that your entree here and your ability to meet fellow innovators in the healthcare space, and certainly some of the leaders from our healthcare providers that are so dedicated these days to working with our own existing population in a very difficult time, just like everybody else is experiencing all across this globe. So we have been talking with Chris Palmieri. He is the president and CEO of Commonwealth Care Alliance, soon to be coming to Rhode Island. Any final words, Chris, that you would like to leave us with? Thoughts on what we've learned, just collectively as humans, as we
Well, I think that we've learned that our resolve is incredibly strong, and we have been able to get through what is maybe one of the worst times in the history of our country. And with COVID, a vaccine is now underway, and we hope that a year from now things will look much different and maybe much more familiar to an earlier time, and maybe with some respects in a positive way, much different. We're really excited to be able to come to Rhode Island and join the business community and serve so many of the eligible consumers. And Laurie, we appreciate the time that we spent with you today, and really look forward to more conversations.
Mm-hmm. A special person leading a special organization. So thank you, Chris, for spending time with us today, and we will look forward to seeing you soon.
Thank you so much.
Take care.
Bye-bye now.